So guys, today I am going to discuss about the mycetoma. First of all, I would like to say if you not subscribe my channel, so please subscribe and press the bell icon to never miss any update. So guys, let's start the topic. First, mycetoma. So this mycetoma is a chronic fungal infections that mostly occurs in our skin and subcutaneous tissue, and in mycetoma its granulomatous lesion occurs, and this mycetoma is characterized by trait means the group of three, this group of three sign and symptoms like swelling, sinus and granules discharge. So guys, this mycetoma is first described in Madurai, that is in Tamil Nadu, South India in 1942, and this caused by Madhurella mycetosis and Pseudoscaria bodies and so many others, other fungi also. So these are the causative organism of mycetoma. So guys, what are the types of mycetoma? So mycetoma are subdivided into three types. One is the eumycetoma, other one is the actinomycetoma, and the last one is the botryoomycosis. So what is eumycetoma? So here I am discuss little bit about eumycetoma and actinomycetoma and botryoomycosis. So eumycetoma is a chronic granulomatous fungal disease, and this mostly affect our limbs. And the actinomycetoma, this is also chronic, but this is the bacterial infections that affects our subcutaneous tissue, and it affects the skin and connective tissue of the individual. And the guy botryoomycosis, this botryoomycosis is a rare chronic bacterial granulomatous infections, and it's affect mostly in our skin and rarely in the visceral organ of the body. So guys, these three are the types of mycetoma. Now I am going to discuss about the differentiation between the eumycetoma and actinomycetoma. So this eumycetoma is caused by fungi, and the actinomycetoma that is caused by bacteria like actinomycetes bacteria. And this eumycetoma is a fungal, has a fungal hyphae, and here in actinomycetoma the filamentous bacteria are present, and the grain is maybe in black or white color, and here in actinomycetoma the gray present like white and red in color. If the granules are present in black, then this black granules caused by Madhurella mycetomatis fungi, and if that granules present as white, then that is caused by Pseudoscaria body. So guys, here this actinomycetoma, that granules present like white, then that is called by actinomadhurella madhurai, and if it is present as red, then that is caused by actinomadhura pelleteri. So guys, here if in eumycetoma the tumors present, then the tumor may be single, and in actinomycetoma the tumor may be in multiple. So guys, here the sinus, if the sinus present, then that appear late and few in number. But in actinomycetosis, in actinomycetoma, that sinus appear early and numerous, or a number of tumors, sinus raised inflamed open area. So guys, these are the examples. These are the difference between the eumycetoma and actinomycetoma. Then what is the pathogenesis of the mycetoma? So this mycetoma is caused by the saprophytes that is mostly found in the soil and on the thorny shrubs, and this caused by these infections caused by the Madhurella mycetomatis fungi. So guys, these infections occurs as a trauma, and it's transferred to the skin or occurs on the skin. And initially this mycetoma occurs as a neutrophilic responses. So guys, what is the epidemiology of the mycetoma? So mycetoma is a endemic disease, and it mostly occur in the Africa and India, and in India it mostly occurs in Rajasthan. So in Rajasthan, these infections are the most commonly occurs, and it also occurs in the South America. So guys, these are the epidemiology of the mycetoma. So what is the clinical manifestations of the mycetoma? So mycetoma comes under the TRAD. TRAD means swelling, sinus, and granules will be discharged from the sinus and the swellings. So guys, these are the main clinical manifestations of the mycetoma, and we can also add the difference between the eumycetoma and actinomycetoma in the clinical manifestations. So guys, what is the diagnosis of the mycetoma? So mycetoma, we can diagnose mycetoma by a specimen collections from like grains from the skin or from the infected area. And we can also examine mycetoma by direct examination. We can direct ask few questions from the patient. So guys, move to the treatment of the mycetoma. So we can treat mycetoma by surgery, and after surgery we should give a patient we should give patient drugs like itraconazole and amphotericin B. So in eumycetoma, if a patient who are suffering from eumycetoma, then we should give itraconazole and amphotericin B. But this amphotericin B we should give the severe cases of the eumycetoma fungal infections. And actinomycetoma, in actinomycetoma, Wells regimen, we should give Wells regimen. In Wells regimen, amikacin and cotrimoxazole, we should give these two drugs in actinomycetoma. So guys, these are the explanation of the mycetoma, what is the types of mycetoma, differentiation between the eumycetoma and actinomycetoma, pathogenesis, epidemiology, clinical manifestations, diagnosis and treatment. So I hope you like my video. Thank you so much.